You're not just dreaming up ideas, you're developing approaches that could fundamentally transform how we deliver public health and inform countless lives. But what makes these innovations stick isn't just potential, it's how we bring them to life. Greetings, everyone, and thank you for joining me on this episode. Welcome to Public Health Entrepreneurs, the podcast for visionary leaders who are ready to transform public health and healthcare through innovation. I'm your host, Dr. Charlotte Huntley, and as a public health entrepreneur with over 25 years of experience in healthcare and public health, I understand the unique challenges and opportunities that come with bridging multiple disciplines. If you are a high-functioning leader with expertise across different fields, whether you're a medical doctor, a dentist, or pharmacist who also has a public health degree, or a public health doctor who also has expertise in another field, or any other interdisciplinary professional, you know what it's like to see opportunities that others miss. You also understand the gaps in our current systems, and you probably have a lot of really good ideas about how to make things better. I also know that sometimes having a unique perspective can feel a bit isolating, a little heavy sometimes, and I definitely understand. It's why we focus this podcast, especially this current series of episodes, to provide you with the type of support that you need. On today's episode, we are going to take the discussion from the previous episode about the requirements of both vision and careful planning. If you didn't listen to that one, make sure that you listen to the previous episode. But we're going to take that into a discussion about the art of strategic innovation in public health. So let's dive in. There are 4 things that I'd like for you to consider. And the first is simply understanding innovation in public health, different types of innovation, process, service, technology, balancing evidence-based practice with new approaches, and identifying areas ripe for distribution or disruption. Common barriers to innovation. These are all things I'd like for you to consider. So let's talk about what innovation really means in public health. Because it's not just about shiny new technology. Sometimes it's about finding smarter ways to deliver services, streamlining processes that have been clunky for years, or using existing tech in creative new ways. The tricky part is finding that sweet spot between tried and true methods and fresh approaches. We've all seen those areas in our health systems that are crying out for change, but we also run into those brick walls, budget restraints, resistance to change, or regulatory hurdles that can make innovation feel like an uphill battle. I know, we're there. The next thing I really want you to think about here or to highlight is developing a strategic innovative framework or strategic innovation framework, depending on how you want to phrase it. Basically, assessing current systems and gaps, evaluating potential solutions, risk management methodology, and developing proof of concept. Before diving into any major changes, we need a game plan. So think of it like doing a health checkup on your current system, where are the pain points, what's working, what's not. Once you've got a clear picture, you can start exploring solutions that actually fit your needs, not just what's trendy, but it also not just like you wouldn't prescribe a treatment without considering the risk. You need to be careful and weigh out the potential downsides of any innovation. This is where building small scale proof of concept comes in handy. We've heard this a lot. We've used the phrase, but that proof of concept is really important. They're like clinical trials for your ideas. All right. So next, I want you to think about development implementation strategies, building stakeholder support, pilot program development, measuring impact, and scaling successful innovations. Now, implementation is where the rubber meets the road, so to speak. You can have the most brilliant innovation in the world, but if you can't get people on board, you're not going anywhere. So start by building a coalition of supporters. Find those early adopters who get excited about positive change. Then test your ideas in a controlled environment through pilot programs. Keep track of what's working, what's not, and be ready to adjust as you go. When you've got something that's clearly making a difference, that's when you can think about scaling up. This gets exciting. All right. So the next thing I want you to think about is sustainability planning, financial sustainability methods, resource allocation, long term viable assessment, impact measurement frameworks. Now, let's be real. Even successful innovations can fizzle out if we don't plan for the long haul. It's not enough to secure funding for the initial rollout. You need to figure out how is this innovation going to sustain itself over time. That might mean developing different funding models, being smart about how we allocate resources, or finding ways to demonstrate ongoing value to key stakeholders. The goal just it isn't just to make a splash, it's to create long-lasting positive change in our health systems that continues to deliver value year after year. Get energized with these topics. So, as we kind of wrap up, as we reflect on strategic innovation in public health today, I'm struck by how the most impactful changes come from blending boldness with wisdom. You're not just dreaming up ideas, you're developing approaches that could fundamentally transform how we deliver public health and inform countless lives. But what makes these innovations stick isn't just potential, it's how we bring them to life. It's important. So it's not just, once again, it's not just about these bright ideas. And what really makes these innovations stick and last is their potential, but also how we bring them to life. You've got the key elements in your toolkit, understanding what meaningful innovation looks like in your setting, creating a strategic framework that makes sense, planning implementation that gets buy-in, and building for the long haul. Take time to pressure test your initiatives and bring the right people along with you. You know what success really looks like. You really do. Remember, whether you're tackling immediate pain points or reshaping entire systems, great innovation isn't just about what we create, it's about how thoughtfully we bring the vision into reality. That's how we make lasting change in public health. As we wrap up this episode, I'd like to remind you that I have 2 ways to support you on your entrepreneurial journey. If you are looking for personalized guidance, then let's work together one-on-one. Right now, I have capacity and the ability to do that. I don't always have that opportunity, but right now I do. So as someone who understands the unique challenges of being interdisciplinary leader, I can help you turn your innovative ideas into reality. Now, if you are ready to join a community of high-functioning leaders like yourself, consider applying for our premium mastermind group program. You'll connect with other professionals who are, like you, bridging multiple disciplines and creating meaningful change in public health. You can find the application and more details about our mastermind program at publichealthentrepreneurs.com. And if you're interested in the one-on-one option of working with me, just on the contact us page or that tab on the menu, just click that, submit a message that says, hey, I heard about this opportunity to work one-on-one with Dr. Huntley. I'd like to know more, and we'll follow up with you. All right, everyone. Until next time, have a fantastic rest of your day.